And we begin this half hour with the monkeypox cases still surging in the U.S. Thank you for staying with us. I'm Glenda Lewis.
And I'm Brian Abel. According to CDC data, the U.S. has one of the highest caseloads of monkeypox in the world right now.
Yeah, right now there are over 18,000 confirmed cases in 75 countries. In the U.S., there are more than 3,500 cases. And in Michigan, there are 25 cases, including 9 in Detroit, 6 in Oakland County, 5 in Macomb County, 2 in Washtenaw County, and 1 in Wayne County. There are also 2 cases in Kent County on the west side of the state.
And for more on this, our chief health editor, Dr. Partha Nandi, joining us now. And Doc, should we expect the numbers to keep rising?
Yeah, I think they will. We have, I think, the second highest rate in the entire world. I think Spain has a little higher than us. But here's the thing, right? I think that people have let their guard down a little bit, because what happens is with this infection, it can be 4 weeks after you get infected, really getting any symptoms, right? So what happens is people think, well, I'm okay, and then can spread it. And as you remember, I've talked about the symptoms multiple times: fevers, headaches, swollen lymph nodes, and then you get this rash, this characteristic rash. The rash usually happens about 2 to 3 days after the fever. And what happens is that people can actually get infected one whole day before you get the rash. So you can see lots of people are asymptomatic and can spread this. So we expect, and I think all the authorities expect the infections to increase in the numbers in July and August. So we got to be really vigilant here.
Yeah, and some experts say that we need to search for monkeypox cases beyond those who are considered most at risk. Can people get this virus while out in public, say from touching door handles or elevator buttons, things like that?
This is the biggest question I get asked, Brian, is that, hey, is this going to be like COVID where it's going to spread through the air? Am I going to get this from touching my door handle? The answer is absolutely not. It's from prolonged personal contact, right? And right now, 99% of the cases, Brian, are with men who have sex with men. So the World Health Organization is asking, if you could limit the number of partners, at least for now, and then let's see how things go. Here's the other thing, though. I think we're really spending a lot of time, of course, letting the bisexual and the population of men who are having sex with men. We're concentrating on those, but other members of society are also getting this infection. We had two children and a pregnant woman who also were infected. Why that's important is because they can especially get symptoms and possibly have more complications, and including the immunocompromised population. So the key is that absolutely, should we tell people that if you're a man having sex with men, are you at increased risk? Absolutely, but the rest of the population also has to be vigilant, and we have to look further. Remember, personal close contact. It's not from door handles, but the whole country really has to be vigilant and look for those symptoms. And as these cases get more and more, I think they will be. We'll keep a close eye on it, and then talk about things like, for example, the vaccine and how we can prevent it. So, but really, really important that the World Health Organization's increasing their levels of awareness, as well as the health authorities locally.
And Doc, just real quick to clarify, this is behavioral. It's not just being a member of the LGBTQ community in and of itself that makes you more susceptible to the virus. It's the behavior associated, correct? So it's not identity, it's behavior.
100%. And remember, it's what we're talking about is epidemiology, which means that 99% of cases are seeing in those groups of people. It doesn't mean everybody there just automatically is going to get the infection. It's just, like you said, the behavior. But everybody needs to be vigilant, and if you have symptoms, let your doctor know.
All right, Dr. Nandi, appreciate your time as always. Thank you, sir.
Thank you.
And if you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.